Blood pressure is the force of blood pushing against the artery walls. So this force is generated with each heartbeat as blood is pumped from the heart into the blood vessels. So the size and elasticity of the artery walls also affects the blood pressure. Each time the heart beats, pressure is created inside the arteries. Pressure is greatest when the blood is pumped out of the heart into the arteries. So when the heart relaxes between beats, the pressure in the arteries falls. So today let's talk about the two numbers recorded when measuring blood pressure. The top number, also known as systolic pressure, refers to the pressure inside the artery when the heart contracts and pumps blood through the body. Bottom number, also known as diastolic pressure, refers to the pressure inside the artery when the heart is filling with blood. So both systolic and diastolic pressure are recorded as millimeters of mercury, that's mmHg. This recording represents how high the mercury column in the blood pressure curve is raised by the blood pressure of the blood. So in most cases, blood pressure is measured with a blood pressure curve and a stethoscope by a nurse or any other healthcare provider. You can also take your own blood pressure with an electronic blood pressure monitor. These are available at most pharmacies. Today let's talk about the levels of blood pressure for adults. Stage 1 involves a systolic range of 140 millimeters of mercury to 159 millimeters of mercury. The diastolic range of 90 millimeters of mercury to 99 millimeters of mercury. Stage 2 involves a systolic of 160 millimeters of mercury or higher. Diastolic pressure of 100 millimeters of mercury or higher. Then pre-hypertension can be at a systolic range of 120 millimeters of mercury to 139 millimeters of mercury. The diastolic range of 80 millimeters of mercury to 89 millimeters of mercury. The normal blood pressure has a systolic of less than 120 millimeters of mercury and a diastolic of less than 80 millimeters of mercury.